Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Carleen Donnelly, Executive Director at CUPS Calgary, a community health centre in Calgary, Alberta, that has been helping Calgarians overcome adversity since 1989 and has been named one of Canada's top 10 impact charities by Charity Influence for the past 5 consecutive years. We are also joined by Nicole Letourneau, Research Chair of Parent and Child Mental Health and Professor at University of Calgary, and has created the Attach parenting program being used at CUPS Calgary. How are the two of you doing today?
Great.
Wonderful. Glad to hear it. So we have had the pleasure of featuring CUPS Calgary on the podcast before, discussing the work that you were able to do with the funding provided to you in partnership with PHAC through the CVP National Project. Can you remind listeners who maybe didn't hear that episode about your community health center, the programs you offer, and the clients and community that you serve?
That's the question to me. So I'm having trouble hearing.
Tell us about CUPS.
Sure. CUPS, we're celebrating actually, we're way past the 30-year mark now and coming on to our 33rd year. But we originally started out as a community health center, and I would say in many ways, looking at health and wellness from a broader lens than just physical health is really exactly what we do. And it's why partnerships with university and entities like Nicole are just so critical. And so we have education for both parents and children. We have housing programs, both housing placements that we offer and in-home supports, and market placements for a wide variety of clients and patients. And then we have, of course, our health clinic that is including primary care, women's health, mental health, and a whole host of specialty services. The focus of our work is for complex patients and individuals, and it's really around those that have many barriers, and including low income. Some are homeless, some are housed at risk, some are just struggling to keep up in this economy. But many of our participants that come in are also coming in with past childhood experiences that are challenging. So we are all Brain Story certified with the Palix Foundation, Alberta Family Wellness Initiative, and we really are very focused on not just trying to meet the immediate need of people coming through our doors. We understand trauma has really been a very significant impact to homelessness and mental health issues and addiction issues and other social issues. And so we not only want to meet that need and adhere to the 3 principles that builds resiliency, reduce that stress, build supportive relationships, and develop core life skills. So we do our work based on how do we reduce stress enough to do the other 2 principles. And that's really important that we do that in partnership with evidence-based entities like Attach and others with the university. It's why I'm such a big believer and supporter, and believe that I too have to show up and be a partner in research and constantly learn based on what we know. And I truly believe that is both preventive and upstream thinking. And if we can do that, and knowing how much weight it coming out of COVID we are with our social conditions and our social factors that are weighing down our healthcare and our education and our community, we really have to get more minded and join together to really be meeting that immediate stress, but planning in our care plans to get upstream thinking and be addressing that trauma.
Amazing. Thank you so much for that great response. And I wholeheartedly agree. And I am excited to hear more about Attach specifically. But before we get into Attach, I'd like to turn now to Nicole, co-founder of Attach. I believe that's like the right terminology. But please tell us a bit more about yourself and the work that you do with the University of Calgary.
Yeah, sure. And first, I'd say how grateful I am to get to work with Carleen, because wow, you just hearing you talk about the great work you've been doing at CUPS and leading all these years. It's just really inspiring. It's wonderful to be able to connect with you here and just as a colleague in general. But yeah, so I'm a professor at the University of Calgary in the Faculty of Nursing and Cummings School of Medicine, and I've been really fortunate because I've been able to focus on research for my entire career, and so I've been interested in a lot of the things that Carleen's organization focuses on: supporting parents, helping people when they've been traumatized, either in their own childhood or currently, and just trying to help families overcome those stressors and traumas to provide the best environments for their kids to grow up in. We talk about the toxic stressors, as they say, and my research has been largely focused on maternal depression, parental depression, family violence, and addictions, low income, those things that really undermine people's abilities to, be high functioning, undermine children's abilities to, meet their potential. And yeah, Caroline's organization, hits those targets every single day. So it's, you could see why I gravitated toward Caroline and the work that she does. In my research, I've been really interested in not just understanding how those things impact health and development of, the adult or the child, but actually how we can intervene to promote better outcomes for kids and families. And it's all about having an evidence base for the supports and services that you deliver. So much of what we do is well intentioned, but we don't really get very systematic maybe about how we deliver a program or how we evaluate it. So it's really important to be really clear about what works and keep delivering those programs, contextualizing them for the family as they present, definitely. But so a big part of my research has been understanding how those toxic stressors affect health and development of kids and their families, but also how to intervene with families so that kids have the best start in life. And, I've worked with the most troubled parents, and they still want the very best for their kids, So, it's a great place to start. And so we often work with parents and children and infants under, 5 years of age. And that led us to the Attach program. So I can tell you more about that if you like. Okay, you ready for that, Hillary?
I'm just trying to click
Okay.
on mute. Yes, please.
Okay.
Continue on and tell us how you went from this amazing research into the actual application and the Attach program.
Yeah. So one of the things that we discovered, over the years, and not just myself, but other researchers, is the importance of secure parent-child attachment relationships. And one of the things that really struck me when I was looking at this literature, this research years ago, was a study that showed that the kind of security or insecurity of attachment that a child has with their parent at 1 year of age predicts the health of that child 30 years later. Whether or not they have died, and whether or not they've had any kind of health condition, they're mostly inflammatory health conditions, heart conditions, and that sort of thing. So I was just gobsmacked by that, actually. And we also knew that if a child is insecurely attached to their caregiver at 1 year of age, it puts them on a trajectory of higher risk for some mental health problems over their lifespan, challenges in relationship with peers, challenges that in relationship with intimate partners as they grow older. But the fact that it impacted health in such a profound way, physical health 30 years later, really surprised me. So I wanted to do something about that. And so we developed the Attach program. We looked at things that we looked at the interventions that existed to promote secure parent-child attachment. And we found that a lot of them were kind of cost prohibitive. They involved, as important and valuable as it is, like infant parent psychotherapy, very expensive, very hard to deliver, very specialized training is required to deliver infant parent psychotherapy. It's known to actually improve parent-infant interaction quality, which is what we wanted. But an agency like Carlene's certainly couldn't, these infant parent psychotherapists, they're psychiatrists with advanced training and stuff. They're few and far between. And when you do find them, they're so busy, and it's extremely expensive to keep them in any organization. So we wanted to develop a program that would make sense to deliver in the community with the staff skill set that organizations like Carlene's already has. And so when we had this idea, I don't know, 6 or 7 years ago, I came to Carlene and her team, and we talked about, okay, there's a few things we think this should include. And we want to be able to have it so that your agency staff can deliver this program. And it's going to be a shorter program. Some of the other things we saw in the literature is 18 months, 2 years of therapy is what it was taking to actually change these kids from insecure to secure, or support these families in a way that would promote secure attachment. And that just didn't seem reasonable either. So we looked at the literature and came up with a plan, and that's what Attach turned out to be. We decided it could be about 10 to 12 weeks. Training would take 2 or 3 days. Would be the training for team members people that work in Carlene's organization. We have a social work background, or a child life background, or nursing, or some kind of psychology background. Undergraduate education would be sufficient. We would train them, and then they would be able to go on and deliver that program in their organization. And we also decided that we would focus on thoughts and feelings, helping parents tune into their child's thoughts and feelings is like the core concept that we focus on week upon week. We also decided that we wouldn't do things like teach parents about attachment, because it's not about lack of knowledge about attachment that is the problem. It's that parents don't have this the support to actually take the time to be with their child and actually think about what that little person is thinking or feeling, rather than just an extension of themselves or just dealing with their day-to-day life when their child's just there. So we took these elements that we found from the research, we built them all into Attach, and lo and behold, it's turned out to be a very effective program. Like I've developed other research interventions over my career, mothers with depression, and various other groups, teen mothers. I've never seen anything like this. It really works. It does promote secure attachment. We're happy about that. Promotes healthy child development. It helps parents. We determined they're more reflective in their interactions with their children. They think about their child's thoughts and feelings more. And when they do think about their child's thoughts and feelings more, they're more sensitive and responsive. And that's what, fuels the building of healthy brain architecture, those serve and return interactions that we care so much about. So we developed a simple-ish intervention that could be delivered to, standard staffing skill set of agencies like Carlene's, and have been delivering that program ever since, and keep on doing it. I could talk a long time, so I should stop. But anyway, we're happy about Attach and happy we're delivering it with Carlene, and her team definitely helped shape the program in the beginning.
No, that's amazing. I'm extremely fascinated by it. I find it super interesting because I do know firsthand that parents who have to live in crisis and in trauma response just simply don't always have the capacity to be empathetic or have the right emotional attachment styles for their kids. And so I hear and feel a lot of what you're describing and explaining. I think it's amazing that CUPS is able to, like effectively roll out this program, which is my perfect pivot to Carlene. If you could tell us, how did you end up learning about Attach, and tell us about, how the partnership sort of developed and a bit of like the rollout from your perspective?
Well, first and foremost, if you know Nicole outside this interview, she's a go-getter. And she's walks her talk about being community involved. And one of my things that I'm the most impressed about University of Calgary, and in this instant, one of the faculty of nursing, is just that a lot of the research and a lot of the findings that they have is also engaging community with. So it isn't just a great research project with the great findings. It's about trying to make practice different. So that whole, research, practice, and policy shift, it's that cycle we're all kind of doing, and it's truly valued that everyone has an equal weight in that. So working with Nicole has been a tremendous honor as well. But for me, when this was brought up as an idea, it was a natural extension from our current education programs. And I always shy away from saying parent education, because it's so much more now than just parent education. And there's caregivers, and whoever the two primary caregivers are who we want to engage. And that can certainly be beyond parents, but if it's parents, that's great too. But looking to have partnerships that really value how does this make a difference based on what we know now, fit our current programming and a trauma-informed approach. And as I said, being Brain Story certified, was really about how do we empower these parents to not necessarily feel life is happening to them, but that they have a better understanding of their child, how that child's brain develops, their role in that, how they play the best role in enhancing that, all in while mitigating the in often very stressful environments and very time-consuming environments that they live in. And so it really just made sense, because we have one program called Nurturing Parent that really addresses how your brain develops, what happened to you as an adult in your childhood, how that changed or affected the trajectory of your life, and then how can you change that for your child if it was head negative roads, and how can we understand those needs? How can you separate yourself from your child, but have ability to do more than bond and think your role is to feed this child, keep it safe, and keep it, feeling loved. It's way more than that. The role that they have in actually building this very complicated brain into adulthood is massive. And we really felt strongly that when we presented this, it was something that deeply and emotionally affected many of our clients and participants, in the sense where, even understanding what happened to them as a child wasn't their fault, but that they actually could now move into making effective change in having, a very strong role in making sure that their children maybe didn't go down a lot of the same roads. So this was a natural extension. So learning all that and then looking at attach, it was a natural fit as a next step of development for a lot of our families. And they verbally said that. And, as much as reflective functioning and understanding that your child is a separate being, it sounds simple, but it's not. When you understand that people that have been impacted by trauma and in their childhood, a lot of very horrible things have happened to them, it does create for some a mindset that life is happening to them. They actually don't have a role in driving the outcome of the life, is what they often think. And empowering them that they do have that role, that their child is a separate little being, and that they need to navigate understanding what that child needs and what they would want in their own self, and how that's separate. And it's not just as simple as understanding that, but you're changing and empowering and building resiliency in a population that don't really feel they have power and don't really feel they can change the outcome of their lives. And adding to that self-esteem, because I would tell you that most people, by the time they go through a lot of programs, do have great ability, but they don't always know it. So this program was a natural extension to Nurturing Parent, to continuously reinforce they do have the power to drive their own life. They are massively, the biggest influence in their child's life, and that is two separate beings that you can influence. It really, we've seen such a positive effect of our caregivers really becoming more proactive versus looking to us for, to say what next to do. And I think that's honestly why this program is so important to be applied in practice. And when this research program was done, we talked to our staff, we talked to the leader there, and attached staff, Martha and her group were very, very involved. And we decided as a group that we wanted to keep it going on our own entity. So to me, that's a perfect example again of the positive, collaboration between research and practice, that has to be done more. It really does, because these things are very, very effective. They're tested, they're tried, they're shown to be effective. And when we see it in practice and get added that feedback of our participant feedback, it really does change how we design our programs. And we go back to our participants all the time and say, you drove that change. You were the one who said you needed this and that you're benefit from it. So again, it's always that last stage of empowering people to understand they're not passive in their life, they are a driver.
Absolutely.
Long-winded answer, I know.
No, it was, again, you guys are just being very thorough in the explanation of this. And I do fully mean that. I think that this program is amazing. And you named a lot of good, positive things that have come from this. I wanted to give you an opportunity, though, to name any other successes that have come from having Attach at CUPS, or any challenges as well that have arose while, at the starting point, or anything like that while having the program.
I'll just jump in and say that, understanding that our participants wouldn't know what reflective functioning is in the beginning of this program, they will often say themselves that they feel they have a much better understanding of reflective functioning and even executive functioning development. And I mean, that's self-regulation and planning and problem solving and coping skills. These are all important skills that often people in trauma they don't have development in. So hearing them talk about that and relating that to, I see my son does this and doesn't like that. I didn't know that because it doesn't bother me. And it's amazing to see them take control of the narrative and the action. So I would say, again, that building of you are the driver of your own life and empowerment and through self-esteem makes the difference, particularly with the vast majority of our clients in our family development being women and moms. it's not a kind world for a single mom. It just isn't. And it's incredibly hard, even as women in general, not to always struggle with self-esteem. But when you are a single mom to one or multiple kids in a low income and not always given the grace of that you are an amazing survivor, it's great to see that self-esteem and executive functioning skills grow, because that is what's going to change everything.
Amazing. And Nicole, did you want to share any thoughts on some successes or challenges, either with, you know, the implementation specifically with cups, or at all in the process that our audience might be interested in knowing about?
Yeah, well, there's a lot of things I wanted to comment on what Carlene's been saying. And you know, and even that you touched on too, Hillary. I just want to also say, you mentioned Martha Hart. So she is the co-creator of Attach with me, and she was my postdoctoral fellow. You know, when we had this idea, but we'll make sure we give her credit. And she's been really leading the charge in the delivery of the program at CUPS and other places too. In terms of successes, like one of the things that really surprised us, and I'm going to touch on a few comments here that you made, Carlene, in a different way. One of the things that really surprises is how low the attrition was. So usually when we do intervention testing, you know, we have a treatment group and a control group, and you know, that's the standard scientific way of doing things. We expect 50% of people to drop out of treatment and control. We kept over 90% of people in the treatment and the control condition. The control condition parents would also get the program at the end, right? So I think they were hearing positive things about it from the people that were in the program, and they would just stick around to get it too. But we've never seen anything like this. So we've been like puzzling for years now, but why is it? Because it persists in being that way. When parents start with Attach, they tend to stay for at least 10, 12 weeks. They really like it. And so some of those reasons are, I think, relating to what we're doing and the approach we take with Attach, which builds exactly on like what Carlene's talking about. It was the next step when you think of parent education or parent support. One of the reasons why, you know, we kind of think about what kind of term should you use, because when you say parent education or whatever, there's an implication that parents need some education, like there's a deficit there, right? So what's the right term to use? I'm not really sure. But with Attach, we never assumed there was a deficit. And we don't assume parents need to know anything. Like this is a strange and different approach that we take that's very rare. But we have this attitude, and I think it's grounded in reality, that everybody has this skill. Everybody can think about other people's thoughts and feelings. We're social beings. Everybody can do that. We call that reflective function. All right, the ability to think about others' thoughts and feelings and our own, actually, you know, think about the metacognitive skills. Everyone has that ability, but people that are traumatized and have a lot of stress in their lives aren't there. They're reacting. And, you know, if you think of the brain basis of what we're trying to do here, people that have had a lot of trauma, a lot of stress, they're working from their amygdala. It's a threat surveillance system. And when you have, and it makes sense, why wouldn't you adapt and say, you know, look at for the safety of everyone in your environment before you take time to think about the thoughts and feelings? Who has time for that stuff? It's higher level stuff. You know, you're functioning to actually meet basic needs and address threats as they arise, because that might have been the reality. And that person who I'm describing, say, it's not to say they don't have the ability to think and imagine what other people are thinking and feeling, think about what other people are thinking and feeling, but they just don't practice that all the time because of the way they've been raised or what's happening in their lives right now. So we give them this space, an hour a week, where that's all we do. We talk about, what are you thinking and feeling? What's your child thinking and feeling? What are other people in your network thinking and feeling about, you know, a given situation? And it's quite unbelievable, the change that we see in people just when they're given that freedom, that you know, I can actually do this. I don't have to worry about my environment right now, the threats, you know, that I might need to address, but I can just think about this thing. I think it must be, there's something about that that's so positive that keeps people coming back. And we also, like I said, we don't, you know, we don't talk about anything else. We don't say, oh gosh, you need to know about attachment and your child's milestones, and, you know, read and play with your child, play peekaboo, like all those sort of standard things that parents are kind of inundated with when they have babies. You know, sing to your baby. We don't talk, nothing like that. Do what you do with your baby. All we're going to do is talk about thoughts and feelings. And so, I think what has been ending up happening, my team and myself, like we look at outcomes around the, you know, how the parent-child relationship improving, is the parent reflective function improving, is the child's development improving, is the child more likely to be securely attached. We also found, by the way, that when parents go to this program, they have epigenetic biomarkers that show that their stress is decreased. Their ability to, and their inflammatory responses are decreased. So I could talk a bit more about that later, but that's a pretty exciting finding. But anyway, we think that what's happening is that they're using their prefrontal cortex more, and that's generalizing to other aspects of their life. So not only are we improving their outcomes with their kids, we think, but they show up at appointments because they are thinking and planning and using that impulse control, those features of their prefrontal cortex that just have to be, they're exercised in a 1 hour a week session. And one of the other things we do is we have the co-parent with them, co-caregiver, whoever that caregiver who comes to the sessions relies on for their support. We invite them to the session too. And so we feel like this, and they learn about reflective function. So we think that kind of reinforces what the caregiver or parent is doing with us in their day-to-day life. So they're getting, we hope, opportunities to practice this stuff in a bigger way. So anyway, kind of speaking to building on the kind of parenting supports that are provided in a different way, getting parents to actually practice something that we think has generalizable positive impacts on other parts of their life. And, you had asked in one of the questions at some point, what have parents said about it, and, or the caregivers who have attended the sessions have said about it. And they have very positive feedback for us. But and if you want to check this out, you can go to our attach.teachable.com website. And there's a section called testimonials, where we just kind of have been cataloging. And actually, Carlene's testimonial is the very first one. Because we got testimonials from agency leaders who seem to like this program, and also the parents or caregivers. But listen to this one. It says, "It's working to help me think and teach my kids how others think and feel. It's helping with peers at school and with my son. It also helped me work through issues with my son's dad." So, it's like going beyond just that relationship that, with the child that has been our focus. And there's a whole lot of testimonials like that on the webpage. But anyway, I will maybe stop there and see what other questions you might like to focus on here.
No, I think that's great, because as you're speaking about this, it does seem to me that like it would naturally build, in a way, better interpersonal relationship skills. It's just about finding like almost the way in, being how much parents and caregivers and those people love these young children. And if it then, sort of mushrooms out to the rest of society, then that's, amazing community building all around. So much of what CHCs and all of our work is about. But I think that that's absolutely fabulous that it's helping, people in so many other aspects than just this caregiver child relationship. In terms of, and maybe this is where you can talk a bit more about the, the health benefits that you were seeing that you sort of teased. But Nicole, what would you say to community health centers that are trying to implement this program, about any of the benefits, or any other commentary that you have about why it should be implemented?
Yeah, that's a great question. So, I think we're able to say that, and I actually am having conversations with other agencies all the time, and, we're able to say that this program really seems to work. So we have evidence to support its use. And we're continuing to work hard in the research that we're doing now to find out ways to improve it, make it more easy for organizations to take this on and have it continue. So, it works, and we're committed to making it feasible to deliver in agencies. And I hope that would entice organizations. The other thing is, CUPS is a pretty special organization. And actually, I give so much credit to Carlene and CUPS, because if we hadn't had this sort of like open arm kind of attitude from Carlene and her team at the beginning, I'm not sure if we'd be in the place that we are, because there was this back and forth, there was a willingness to share clients, and I was just an unknown entity really to you, Carlene, at one time, but your interest in research and evidence to support programs and services, gave me this attitude that enabled me to walk in the door and with my team and do something that I think has really produced some great results. So I would love to tell other organizations, like, be like CUPS, or be open-minded to evidence. And one thing I have heard from some recent conversations actually is that not every organization, maybe you've had difficulties too over time, Carlene, but not every interaction with researchers at universities is positive. I'm sorry to say. Maybe you've had great experiences, Carlene, but I have heard that other community organizations that might have tried to do something with a university organization, didn't feel completely engaged, or that researcher went in, did the research with the clients, and then the agency didn't get benefit from that. So I feel like it's a two-way street. Like, we as researchers, if we really truly want to make impact, we have to really be true partners. genuinely care about the work that we do, making an impact on, improving the services that the agency cares about delivering in some fashion. We need to be really true partners and engaged in the needs of meeting the needs of the community organization. So I think us researchers have to go to organizations that way. I'd love to say that more organizations are like Carlene's, but I think that there's more researchers out there that have that genuine care. There's going to be more reciprocity from community organizations, pardon me, that currently don't have the time, interest, or maybe bad experiences with research. We need more. But if we're going to be improving and ensuring that services that are delivered to our most at-risk clients in society are optimal, we have to work together. So I think there's a variety of solutions to that, and I try to tackle that some of my other work. But I'd love to hear what Carlene has to say about that too. Have you had some bad experiences, Carlene? In all your, maybe you don't have to name names or anything, but you seem to have a really positive attitude. So I'm kind of wondering about, has it always been positive?
I wouldn't say I've had negative experiences, but what I would say is there's been different type of research projects that's happened on site. So some have just come in, did their hours, got their study and left. And you don't really hear a lot. And I think that's part of why there is a bit of reluctance on some entities to think, well, you come in and studying what we already know. And I've heard things like that. And I think there's a point to it, but I do think, and I would challenge and have challenged other nonprofits and other community players to say, this is part of a mutual collaboration. And it's also part of us really being clear on expectations, responsibilities, and accountability on both sides. So it isn't just, if someone's coming in and doing that, then set a cap on that and leave it what it is. They need to do their studies. They need to have access. But the larger portion of our resources is spent on creating true partnerships with the research entity that will last over a long period of time. So we are very clear that first part is needed, but it's smaller. Our bigger set of limited resources is on that. And so I would challenge others that then create your own portfolio of what expectations, responsibilities, and accountabilities look like in a partnership with a research entity, and find what fits best. It might be trial and error. So I truly do think I've always been just a very, very strong believer that if the nonprofit sector continues to do status quo and add small changes based on, reactive need, we're not really going to get truly uphill. And as I've said, with the social conditions we're seeing, I really believe we have to understand the root cause of these. And to me, the vast majority of those are trauma-based. So I see it very beneficial in terms of these kind of partnerships. And, when I look at my relationship with Karen or Martha with Hart and the team, they've been patient with us. They've been, one of the challenges has been, in some cases, it's kind of a little intimidating and some of our staff were reluctant to really, do I know enough to do this? Do I have the credentials to do this? So there was a little bit, it took a little bit of patience and time to get everyone comfortable in being part of this program and to carrying it on after. Research and research leaders to some frontline staff are intimidating. And so working to make that a comfortable environment. And I think Martha and her team, on site so much, we're incredibly patient and really built really good relationships. So again, everything is about trust and relationship, no matter who and what you're trying to do. And, it's one of the reasons that with vulnerable populations, there is so much, reluctance to work with, entities like health and the police and government and those kind of things, is that trust and relationship is broken. And I think repairing that is critical, again, to building relationships. But we built really good relationships, and that's why the vast majority of our resources are in those long-term connections, because the benefits have been extraordinarily, strong. And I think it has been the time and patience of Nicole and Martha and the group that really has allowed us to be comfortable in this realm and feel we have something to bring to the table, particularly the staff. And they do. And we see, and the clients do. So there's always been, from Nicole's end and Martha's end, an appreciation of that and a reinforcement of that. So change happens, through the EdCare model from, knowledge, education, and awareness, but it's actually that reinforcement piece that really delivers change at the community level. And then the only other thing I would say, so I think that was critical, and they've been, honestly fantastic to work with. And we've been able to back and forth and say, from Nicole saying to me, this isn't really working as well as we can, to me saying, this is the concern. So we're able to be honest and upfront with each other and really massage that. So that reinforcement was critical. But I will end on a slightly different tone, but it's coming streaming from the same. When these kind of programs are applied in community, there's nothing more valuable, in my opinion, although I think this program could be universal to parent link centers, to family care networks, to, literally health centers. I think this is really something that can only benefit anyone already that's a natural flow to a high volume of vulnerable and non-vulnerable people. But we concentrate on fairly significantly vulnerable people. And when you're able to understand that from a childhood experience, most of our participants scored considerably high. When you're trying to empower and help and build skills to those that have been the most devastated by, lack of support and, trauma events have been high, it is the right thing to do to help the most vulnerable. And I am always impressed that Nicole approached one of the most significant organizations in the city that were serving, really a very heavy percentage of significantly vulnerable people, because helping them changes everything in their life, and really empowering them and getting them to understand the world they live in and driving the world they live in is so critical, and so rewarding that they're not being doubly, penalized for the very, challenges that they were born into again and again and again. So empowering them to really make effective change in their lives, to me, is making the greatest change in society. So I've always commended this team on picking us and delivering to that population.
Amazing. And a perfect segue, actually, Nicole, I wanted to give you a chance because you're talking about some of that, lowering some of those stressors and some of those findings. And before I start to slowly wrap it up, I wanted a chance because I'm interested in that, those statistics and findings, because I used to be a science student. So please, if you want to share any of the other, benefits that are just, so obvious.
Well, I guess maybe I'll summarize them. And I don't know if you could put some resources for people on this podcast link, but you can go to attach, as I said, .teachable.com to find out, links to the papers that have been published. And so, as I said, we found it improved parent-child attachment security, child development in various areas, even fine motor development, which is interesting. We found improvements in kids' personal social development, so their own social skills. We found it improved parent-child interaction quality, so parents are more sensitive and responsive, providing more serve and return interactions with kids. And it's all, there's even trends toward, we think we have a bigger sample to be able to see this, but we see trends toward it reducing parents' likelihood of being depressed over the course from receiving the program. And then finally, as I was starting to say, we collected blood, believe it or not, from mothers and babies, and we found that this program down-regulated immune cell gene expression, epigenetically. So these parents and children who received the program compared to those that didn't were less likely to have inflammation or infections or inflammatory disorders, at least in the short term. It's interesting to follow that up. So we're pretty excited about the program, and like I said, I've rarely found anything that seems to work so well. And I even wonder, as I said, if it actually has impacts on their other relationships that we haven't been measuring. And you can find out information about that on the link that I hope you can provide to the website.
Yes, it'll be on the bottom and clickable in the description, and I will get everybody to read their links in just a moment. But first, my second last question for Carleen, I'm curious, like these programs, they're so important, and the partnership is important, but obviously you need a place like a community health center where these things can happen. And so I'm curious, for specifically your community and the clients at CUPS Calgary that you serve, that rely on investment from both provincial and federal governments, as well as health decision makers, what needs do you see from these people that would be improved by those groups of people and your clients in the community?
What needs? Like what communication?
It's always the weirdest question to ask, but what needs does your client base have that would be improved by provincial and federal government investment?
I see. So first of all, we always need provincial community investments.
Thank you.
The public and the private sector is absolutely critical. Um, at the end of the day, what I know to be true, because we have developed our own integrated care tool, and that assesses social and emotional well-being from a 1 to 5, from a range, I should say. It assesses economic supports, including justice, and it assesses mental and physical well-being. So physical, health, mental health, and all those spiritual, cultural, all those specific needs to your life. They're very individually assessed. And we know that through different programs, we can see, we can actually monitor movement and, how they're moving from in crisis or vulnerable into stable, resilient, and in some cases thriving. So to me, again, these investments in these kind of programs and in places that are more community based, that often are entry level for individuals that are very vulnerable. And there's lots of them in the city. The Alex Health Center is another one. We have Kindred as counseling. We have Calgary Counseling. We have many, many that have a lot of flow in. And I think it is really important that we do data collection that can really do here's where they're at and here's what's really going on. So we have universal, intake and assessment. And I think that's important because government is never going to be the innovator. They're never going to be the ones that come up with incredibly big change, but it is helpful for them to be aware what's really going on with homelessness, addiction, and mental health and other social issues. Where is it coming from? And how do we put a plug in the river, so to speak, and stop this? And so I do feel there is an openness to having these conversations. And I think we use example from entities like from research from, or findings, I should say, from Attach, and many of our different programs and from our clinic to say this is making people more well because they feel empowered. They're controlling their own lives. They're less depression. They're moving positively forward to get positive supports instead of staying in their comfort zone with some negative supports. So we can track a lot of that and we can show movement towards literally resilience and owning your own life, merging into community and not needing us anymore. And the way our programs generally work is they come through programming and then they go to community, we go to them, and then we slip away and they are built reinforcement community. So to me, we see that movement with programs like this, and we see that empowerment, and we see them move away from us and come back and volunteer. In some cases, they come back as students to do the practicum. So there is a lot to be said for looking at those 3 principles of resilience, reducing stress, building supportive relationships, and building core life skills. Because that's, if you're not born into a family that taught you that, that's what's going to build resilience. And these programs, such programs like Attach, absolutely help to reinforce that. And we can support the reduction in stress to allow them to really get the most out of these kind of educational experiences. And so it's hand in hand. We create the environment, the staff knowledge, the ability to reduce stress, and these programs enhance the learning and empowerment. So I honestly think this is an opportunity to educate and influence policy shifts in terms of what gets funded, how we need to be thinking different on a prevention lens to looking at population health. And there's some starts with that with PCNs, but there's more to do, and the evidence is there. So part of why I believe so much in these kind of partnerships is we all often know the outcome we see, but we can't prove it. But evidence is unrefutable, right? So it's incredibly important to combine both.
Absolutely. Nicole, I wanted to give you an opportunity to comment on that question in case you had anything, or even on what Carlene said. We usually save that question just for that encouragement about investment of community health centers, but obviously where there's a direct partnership, that investment does help your programs continue to impact people. So if you had anything you wanted to add, I want to just give you a chance.
Well, when it comes to these kind of psychosocial population health challenges, all the more funding that goes to these organizations, the better. And if helping organizations make the case for the value of their programs through evidence is, part of the puzzle. I mean, I think all of us researchers should just get lined up and support community organizations to provide that evidence to enable them to get the funding they need to deliver the programs and services that we know work. And the other thing I think that, just I guess a plug to the health research community in the country, is we need to be thinking about ways that are going to make it easier for community health organizations, community health clinics to get involved in research. Right now, a lot of the research funding, you can't really, I've been doing this lately and I don't know, it seems to be working, but I'm getting funding for community organizations that give them money so they can actually be released from their service obligations and actually take part in a project, or maybe delegate their service obligations to someone else because they've got the funding to do so. So there's that funding constraint that organizations are constantly having. Won't be a problem when it comes to being involved in research. So my plea is that if you truly want community health clinics to be engaged in research, the funding opportunities need to provide funding for those community health clinic staff to actually be involved. It's not just a honoraria for the patients or the subjects and studies and the research staff. The community health clinics, their time needs to be honored as much as anyone's, and funders need to be considering that. If we truly want to improve outcomes for children and families and support organizations like Carlene's to get involved, then we need to actually provide funding for them to do so. That's my last plug. That's my new hobby horse.
Yes, apparently it's been catches for some time now, so we fully agree. I want to thank you both for being here, and I will ask briefly. I know, Nicole, you said it was attach.teachables.com, correct?
Not plural teachable, so just attach.teachable.com. Yeah.
Perfect. And was there anything else you wanted to plug in terms of websites, maybe Calgary, or any way else that if anybody wanted to reach out to you about the program or get involved?
Well, we also have this. Oh, go ahead, Carlene. You go first.
Sure. We just want to plug that we're the Alex, myself, and former Boyle Macaulay up in Edmonton. We're part of the national CACH big committee with Scott Wolf, and they were recently out in Calgary and did some site tours, and it was so meaningful and so exciting, I have to admit. And I think they got a better understanding of this connection. And so when I was able to reach out and say, could you kind of spread this around? We want to see how we can apply this naturally, because I think this is, in all honesty, a health issue. If we really embrace what health truly means to all of us, it's about being happy in your life and empowered in your life and having all your needs met with access to what you need when you need it at the right time. So I really do compliment them too for being open to constant learning and development.
Yes, happy to hear about the work that all of you are doing over in Edmonton, the Alex, and now renamed the Radius. Radius Health.
Yes, Boyle Macaulay is now called Radius. Yes, Health.
Yes,
oh, really? I didn't know that.
Yes, and I will be having an episode with them, I believe, in the coming weeks, discussing the name change and some of the work that they've done with CBD
awesome.
National as
Trish
well.
is great.
Yes.
She's great.
Yes. So Nicole, briefly, any other way someone to get in contact with you about Attach?
Well, yeah, I mean, the Attach teachable.com website I talked about is one way to learn about Attach, but in the bigger context, this idea of connecting with community and having this synergy between community and academic partners and providing best evidence for interventions and programs to support families affected by adversity and violence, that sort of thing. If people would like to know more about our work in that area, which totally aligns with what we've been speaking about, you can also check out AVA training.ca, because that's our website to do with community university partnerships in addressing these sort of traumas and toxic stressors that affect children and families over their lifespan. So we've got a bigger initiative around that, and Carlene is part of that too in a huge way, and so is Attached.
Yes, perfect, amazing. And then Carlene, the last question is just if anyone wants to learn more about CUPS Calgary and the amazing work that you are doing over there, where would they go?
They can go to cupscalgary.com. That's our website, www, of course. We have a main line that's on that website they can call. My direct email is carlened@cupscalgary.com. I'm pretty flexible and open to talk to anyone within the time frame I have. But I truly believe in partnerships, and I always like the connection and being able to look at how we can bridge what we do as a communities better and better. So absolutely, there's lots of ways to get a hold of us and to learn more what we want to do. And on a bigger scale, if anyone ever wants a tour of CUPS, we are happy to take people through and brag even a bit more.
Yes, I mean, I definitely think that I am due, and I also certainly hope that of the other, I think, approximate 115 members that we have as part of catch that people hear this episode and that they get interested in Attach and interested in the innovation and the partnership here, and go and ask the two of you some good questions and start to implement programs like these all the way to we go as far as Newfoundland, the whole other side. So hopefully across the whole country. I want to thank both of you for your time today and for being on Community Matters.
Thank you so much for putting all those questions together. They were great questions, and for pulling this together for us. It's really important.
Thank you.
Yeah. Thank you so much for bringing attention to this.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.